British Asian Trust has been working in mental health for over 15 years now. The program that we have just completed, the integrating mental health into primary care services, was a 4-year program and really was about coming together to promote mental health service delivery, but also create demand and access to primary care services.
In Pakistan, mental health is a silent crisis. An estimated 50 million people will experience mental health challenges during their lives. Yet stigma, misinformation, and limited services mean that 9 out of 10 people who need support cannot access treatment. Less than 5% of Pakistan's population understands mental health conditions, while only 0.4% of the national health budget is allocated to mental health services. At the same time, there is just one psychiatrist for every 550,000 people, leaving millions without access to the professional care they need. To address this crisis, the British Asian Trust has been working to transform the mental health landscape in Pakistan. With support from the Vitol Foundation and the CareTech Foundation, the Trust partnered with government, civil society, and the private sector to expand access to mental health support and drive systemic change. Together with partners the Skin Health Initiative, Sehat Kahani, and the Global Institute of Human Development, the program focused on integrating mental health into primary healthcare and community systems. Frontline providers were trained in mental health to identify and respond to mental health challenges, helping communities access timely and compassionate support. Through this initiative, more than 128,000 people were screened for mental health conditions. Over 70,000 individuals accessed primary-level mental health services within their communities, and more than 4,000 people received support through helpline services. The program also trained over 400 frontline workers. They were equipped with internationally recognized mental health approaches such as Problem Management Plus and early adolescent skills for emotions, alongside training in psychological first aid, resilience building, and coping mechanisms. The program strengthened the capacity of local health systems to deliver community-based mental health support. As a result, over 27,000 people experienced measurable improvements in their mental well-being. Because when communities have access to the right support, mental health care becomes possible, accessible, and transformative. And together, we can build a future where no one has to struggle in silence.
मैं यहाँ पर डॉक्टर को दिखाने आई थी तो इत्मीनान प्रोग्राम की अवेयरनेस दी जा रही थी यहाँ पर। फिर मैंने इनसे अपने जो परेशानियाँ थी, जो मेरे में ज़हनी मसाइल थे, वो सब मैंने इनसे डिस्कस किए। फिर मैंने इनसे 3-4 सेशन लिए। सेशन में मुझे बहुत सारी ऐसी बातें बताई जो मैंने लिए सेशन, उनसे मेरे में बहुत बेहतरी आई। मेरा जहन जो है बहुत ज़्यादा पुरसुकून हो गया है। तो मेरे घर वाले बहुत खुश हुए और मैंने ये सारी बातें अपने मोहल्ले वालों को बताई और उनको भी यहाँ पर रेफ़र किया मैंने।
मेंटल हेल्थ इश्यूज़ के साथ हमारे पास ख़वातीन आ रही होती हैं बिकॉज़ यहाँ पे बहुत ज़्यादा स्टिग्मा है, और उस स्टिग्मा को रिमूव करने के लिए यहाँ पे डिफरेंट अवेयरनेस सेशंस दिए जाते हैं।
What has been really amazing about this project is we brought together 3 partners who worked in ways that will result in sustainable service delivery for the communities of Pakistan. Our 2 donors, the Vitol Foundation and the CareTech Foundation, came and supported a very fundamental program for the British Asian Trust. These donors have continued to stay the course with us, and that has enabled us to have tremendous learnings to really establish the work that we have done in promoting access to primary care services. So a big thank you to the CareTech Foundation as well as the Vitol Foundation for really staying with us and believing in the British Asian Trust.